Hi, my name is Shaina Horner. I'm a clinical research coordinator in the Infectious Disease Research Unit at the UC College of Medicine. I've worked as a community leader advocating for our local Latinx community for the last 20 years. My passion has always been about removing barriers to care, empowering the Latinx community, and reducing health disparities. During the pandemic, it became obvious that communities of color were being disproportionately impacted by COVID-19, and I jumped at the opportunity to be part of the solution. I collaborated with researchers and community partners, conducting in-person interviews and surveys to understand the facilitators and barriers to care and prevention of COVID-19 infection in the Latinx community. I utilized existing support networks and social media to help educate the Latinx community about the importance of public health measures and testing opportunities. I also empowered healthcare and social service providers with resources to provide culturally as well as linguistically competent care. One of the few gifts of this pandemic is the opportunity to educate people about clinical trials, vaccine production, and the importance of community engagement. In the Moderna trial here at UC, I utilized social media and other networks, giving Spanish language interviews to educate the Latinx community about how trials work, how the vaccine works, and the difference between a vaccine-induced immune response and COVID infection. It was important that a diverse population volunteered in this trial to discover if the vaccine was safe and efficacious broadly. Due to these measures, UC's Moderna trial had over 20% Latinx participation. I've worked to ensure that vaccines were developed and are now distributed in a way that is equitable for Latinx families. I am honored to collaborate with our Latinx participants who are helping save lives in their very own communities and around the world. In the future, I will continue to create space at the table for Latinx voices, advocating for process changes as needed, and empowering Latinx community members to provide solutions that will reduce health disparities in their own community. Thank you.